If you're like me, you're trying to avoid a hip replacement surgery or at least try to delay one. If you're new to the channel, my name's Coach Darwin. I'm a physical therapist, but I'm actually now becoming a patient of myself. So I have a history of hip pain. It's been getting worse over the past couple years. I would say probably the cause is I certainly have some arthritis in there because I used to do a lot of distance running, a lot of marathons, a lot of road races, Ironman triathlon, sprint distance, Olympic distance triathlons, lots and lots of miles on these hips. So now I'm having pain walking, going up and down stairs. Some days are better than other days. I've made some diet changes, some hydration changes, and I feel like it's getting a little bit better, but I always say I'm a great physical therapist. I'm a lousy patient. So one goal for me is to document this recovery process. So hopefully I can inspire some of you guys out there that you can get better and maybe a hip surgery isn't a foregone conclusion. And B, I just want to be accountable to the audience out here to get myself better. Now my goals are, I want to feel stronger. I want to feel healthier. I don't want to feel that pain. I don't want it to limit the things I'm doing. I just started taking up paddle tennis last year, and I just haven't been able to do it anymore because of the pain and the really debilitating pain in the hips after one particular session. So I'd like to get back to just being active. Probably paddle tennis is a goal of mine. And I want to get back to running. Now, it's unreasonable to really think that I'm going to go back to doing marathons. And quite frankly, I don't think I want to. But 5 and 10K road races every now and then, I really just enjoy running. I miss heading down to the beach and just going for a long afternoon run in the sun. There's really nothing like that for me. And I haven't been able to do that for a couple of years now, maybe 2.5, 3 years. So come with me on this recovery process. Please join in if you're needing some work on your hips as well and hopefully wanting them to feel better, whatever your goals are. I'm going to start today showing you 4 very simple exercises, which is the very beginning part of my recovery process. I'm intending to do these exercises every single day. I'll probably stay with this very simple beginners or level 1 plan for 2-3 weeks. We'll see how it feels. And then I'll start to advance the exercises and make them a little bit more intermediate or level 2. So I'm doing this on my massage table or treatment table. You don't have to have one of those. You can do this on the ground if you don't have too much of trouble getting up and down off the ground, or you can do it from your bed. So the first exercise we're going to do is hamstring stretches. And I'm going to use this yoga strap here. If you don't have a yoga strap, that's fine. You can just roll up a towel or a sheet or use a belt. I've got a little loop here. Again, you don't need to have that loop if you don't want to. Lie down on your back. Okay, and what you're going to want to do is just put the strap around the mid part of your foot, or if you have a loop, you can also just loop your foot this way. Now, ideally, as you do this, you're going to want the opposite leg to be flat on the ground, like this. Now, I'm having a little bit of a low back issue, a little bit of tightness, a whole other story. So if you're having any low back pain, you might want to just keep that knee bent up. So normally I'm going to have this leg straight. For today's purpose, I'm going to bend this knee up, and this leg is going to be straight. So you're just kind of holding that. You're going to feel a stretch in the back of the leg here. That's the hamstring. And I'm going to hold these stretches for about 20 seconds and make sure I'm doing each side. Now, for the sake of this video, again, I'm not going to do all the repetitions. I'm just going to demonstrate all the exercises for you. And then when I click the camera off, I'm going to go ahead and complete all of the exercises with all the holds and all the repetitions. Okay, so we're going to do that with a straight leg. And then we're also going to do it with the knee bent. So with the knee bent, you're going to be able to bring that knee up closer to the body. And you're going to feel that stretch just a little bit deeper. The hamstrings is a collection of muscles in the back of the leg. So by by changing the knee angle, you're going to affect slightly different muscles, but you're still going to feel it in the back of the leg and back of the knee. Now we're going to do this straight leg 2 times, bent knee 2 times on each leg, hold each stretch for 20 seconds. Got it? The next exercise is the piriformis stretch. So the piriformis is a muscle in the hip, really common muscle that tightens up as a response to pain in the hip. So it's very likely if you're having hip pain, this piriformis muscle is going to be tight. So for this exercise, what you're going to do is just place your ankle on top of the opposite knee. And now you're going to grab on behind that knee and just gently pull that knee up toward your chest. And you're going to feel that stretch on the outside part of the hip here. Now, one additional thing, for me, that's a good enough stretch. You can see how tight I am compared to yourself. If you wanted to get a little bit more out of the stretch, you could also use your elbow here to press out on that knee to kind of open up the hip a little bit more, and you're going to feel that stretch. So just like with the hamstring stretch, you're going to hold this for about 20 to 30 seconds, and you're going to do it 2 times on each side. Oof, I feel that one. Be real careful on these as well. Don't overstretch this. If you have some arthritis in your hip, if you're having some symptoms, if you stretch aggressively, you might set yourself back. It might actually be more painful after the stretch session. So just ease into this, go very slow and easy, and then make progressions as you start to feel a little bit looser. Okay, the next exercise are bridges. And again, I'm going to have to modify this a little bit today just because of my low back nonsense. So from this position, you're going to pull the abdominals in toward the spine and just squeeze the glutes and lift the hips up off the table, and then come down nice, slow, and controlled, and then relax the abdominals, relax the glutes, and then repeat. Belly button in toward the spine, squeeze the glutes, lift up. So you can see I'm probably not coming all the way to a straight body position here. That's because my back is allowing that. It's a little bit sore at that very end range. So I'm only going to go until my back tells me to stop. So I suggest you do the same thing. But ideally what you want to get is elevating all the way up so the body is straight. I'm going to shoot for about 20 of those. And as I start to feel stronger, maybe get that up to 30 repetitions. But this is one of the exercises that I'll modify when we move into the next phase of the strengthening. The last exercise is going to be a hip strengthening exercise. And you can do, if you have any looped bands like this one, you might incorporate this into the exercise. But for today, I'm going to hold off on that until we get to kind of the level 2 exercises. All right. So for this exercise, you're going to lie on your side. Your hips are going to be stacked up. Knees are touching. And from here, just put your hand on your hips here to prevent yourself from rolling backward. Your body's probably going to want to roll backward to avoid using the weak muscle that we're targeting here. So press your hip forward actively here. And now what you're going to do is just lift the knee up in the air and back down slow and controlled. So go as far as your hip is going to allow you. I can feel my hips start to pinch right about here, so I'm not going to push any further than that. Okay, 20 repetitions. And again, if that feels really easy for you, you can already move on to the more intermediate. If you have a looped band, place it around the knee so you're actually getting resistance. So those are the 4 exercises that I'm going to start doing, and you're welcome to join along with me and watch me on this journey as I get back out to running and hopefully back to life and feeling a lot healthier. Take care, be healthy, and start that new chapter in life.